Hello everyone, welcome to Talk Show with Omotoyosi. Welcome to Ogomse TV, where we'll talk about self-improvement, we'll talk about relationship, we'll talk about health matters, religion, and lots more. Today on the show, we have a very important topic to talk about, and that is IVF and surrogacy. And to talk about this topic, I have a very renowned medical doctor in the house. I'm sure we all can't wait to meet him. But before we dive into the topic of today, I'm going to be saying a few things about our guest, and that is in the person of Dr. Charles Ojeabuo. Dr. Charles is a seasoned medical doctor and embryologist specialized in reproductive medicine. Dr. Charles is also the medical director at Mom's Fertility Clinic here in Abuja, a fast-leading world-class fertility clinic that is fulfilling God's mandate in fruitfulness and reproduction in every home and globally. Dr. Charles is happily married to Barrister Victoria Ojeabuo, and they are blessed with 3 lovely kids. Please let's make welcome Dr. Charles Ojeabuo. All right, so welcome Dr. Charles Ojeabuo. You're welcome, sir.
Thank you. My pleasure to be here.
All right, so it's so nice having you around. I'm sure we all can't wait to hear what you have to say about surrogacy and IVF. All right, sir. Can you please introduce yourself before we go into the topic?
Okay, my name is Dr. Charles Ojeabuo. I'm a fertility specialist and embryologist.
What made you to go into this IVF?
Well, I've always wanted to help people.
Okay.
That's been my passion. I like to help people. So when I see people going through a challenge of trying to have children,
okay,
it's like, for me, as though I'm wearing these shoes, because I had siblings who went through the waiting room.
Wow.
Yeah, so we all went through it together. So that attracted me to go into the field of assisted conception
to help other people.
Yes,
wow,
yes,
that is so nice.
Yeah.
Wow. All right, sir, so can you tell us a little bit about IVF first before we go into surrogacy? IVF.
Okay, IVF is one of the methods of assisted conception for couples who are finding it difficult to have children.
Okay.
But before we talk about IVF, we must try to understand the way a woman's body works.
Yes.
Okay. Now, usually every month, a woman will ovulate 1 egg.
Wow.
And which is expected that when sperms meet the egg, one of the sperm will fertilize, and an embryo will be formed. Then that embryo goes to the uterus, travel through the fallopian tube, all right, where the fertilization takes place, then goes to the uterus and is implanted. Then a child is formed.
Wow.
A baby is formed.
Wow.
All right. So so what IVF does is that IVF kind of like amplifies this process. So women now have to take similar hormonal medications that are produced in the body. Okay. They take them periodically. And they produce, instead of 1 egg, they produce multiple eggs. So these eggs are collected and put in a dish mixed with sperm. That's the conventional IVF. Then fertilization occurs. Wow. And when this fertilization occurs, the eggs begin to split into 2 cells. Then each of those 2 cells splits into 4 cells. Then 4 cells, 8 cells, 16 cells, 32, and it becomes a morula. Thereafter, it becomes a blastocyst. Wow. The blastocyst is a matured embryo, embryo in a baby state. Let me use that word.
Okay.
All right. So then that is implanted in the uterus. Okay. So once the embryos are formed, at a certain time of the woman's cycle, usually between the 19 to 21, the embryos are transferred into the uterus. Wow. And pregnancy occurs. Now, for women who are not able to conceive, maybe the embryos are not transferred for obvious reasons. They have maybe they've done several surgeries in the past, or the uterus is so weak, or too many fibroids, or they have heart conditions that will not enable them to be able to go through that pregnancy journey, antenatal journey,
Okay.
then some of them would need surrogates. So that's where the
Okay,
concept
so
of
that's where surrogacy comes in. Because most people tend to see surrogacy as just because women want to keep in shape. If not that, you see, that is why information is very, very important. Because when you hear people say, this person gave birth through surrogacy, we judge them. We're too quick to judge them that, or maybe they want to keep in shape, just because we don't have like enough information to judge based on surrogacy matters.
Yeah.
That is, in fact, I'm just hearing this for the first time. That
yes,
wow,
there are quite several reasons why people will go for surrogacy. There could be that medical reason, and some people can just electively go for surrogacy because of social reasons.
What do you mean social reasons?
Social reasons.
Okay.
I'm too old. I don't want to go through this pregnancy, vomiting, and everything. Probably somebody has a child, or but just wants some more children, maybe a particular gender, and age has happened, and you don't want to go through that pregnancy experience. Then some of those social reasons include keeping in shape.
Yeah, that's where
so,
I just can't wait for you to mention that, keeping in shape, because most people, especially most of the celebrities, they do it like keeping in shape. So let's be clear on that. It's not just about keeping in shape. There are other medical reasons why people opt for surrogacy. All right, so the next question, sir.
People have different opinion, but being in this field of assisted conception, when I take a sperm and I inject it into an egg, I go home. The next day I come and I see a miracle. Life begins.
Wow.
It means that there is an order that God has put in nature, that when sperm meets egg, life begins.
Wow.
So we don't really do so much. We just create the environment for this natural thing to occur. So for me, I see IVF as a natural thing. It's just that you just get assistance. We don't form sperm. We don't form eggs. We don't form babies. We only form the environment for what would have happened in the human body to occur in the lab, and we take it back to the human body. So God actually have created the knowledge of assisted conception for us to use and fulfill the mandate that none shall be barren in the land. Whether age has happened to you, none shall be barren in the land. Okay, so the knowledge of assisted conception was released but not yet unveiled. It took many years after for man to catch it, and is now being fulfilled in our days. You know, so we are even privileged to have so much opportunity, knowledge in our time. But it is painful that people, it is painful that people are not embracing it because it seems like it's not natural.
And it is very, very natural.
It's very natural.
Very natural.
You know, people are actually destroyed because of lack of knowledge. People are wasting time. People are in the dark because they don't have information. That's why we are here today to tell you that IVF is not a sin.
No, it's
surrogacy is not a sin.
You can hear from the horse's mouth. This is an embryologist telling you today that IVF is not a sin. Surrogacy is not a sin. It is all natural. It's just them creating an environment for waiting mothers to achieve that dream of carrying their godly seeds. Okay, this surrogacy thing also trickles down the generation. When you meet Jacob, Rachel, and Leah, what happened? Almost the same story.
Yeah, similar story.
Surrogacy.
Rachel was not getting pregnant, and Leah was getting pregnant. She was giving birth to many children.
Yes.
So what did Rachel do? She had an agreement. She told her husband, take my maid, Bilhah, that I may begin to raise family through her. That is also surrogacy. And not just surrogacy. In this case of Hagar and Bilhah, it was not their eggs.
Yes.
It was the maid's eggs that were used. It was not Sarah's egg. It was not Rachel's egg. Yes. In these cases, it was also a donor egg. So that also tells us that third-party human reproduction, as long as there's an agreement between couple, is not a sin.
The good thing is that there's nothing we are saying here that is out of the Bible's concept. Like everything we are saying right now is related to the Bible. And that is what our doctor here is making us to understand. If you read your Bible, go to the verses he's been talking about, it now makes sense. And it's now been very, very clear to me that surrogacy is actually in the Bible. So please, it's not a sin, like our doctor has said. It's not a sin. All right, so sir, how long do you think a couple should wait before considering going into IVF or before considering opting for IVF? How long should a couple wait?
Well, for newly married,
Okay.
If you have had regular unprotected sexual intercourse for up to a year, all right, it must be a year, okay?
It must be a year.
It's 9 months. Don't worry. Just wait for 1 year. But nowadays, I get people who are just 2 months married and say, "Doctor, I want
really?
to do IVF." Yeah. So, but it's not. You're not having infertility issues.
I mean, the joy of carrying your own child. I mean, thank God for IVF.
Yeah.
Thank God for
it's
IVF.
really helping families.
So they should wait for like a year.
Yeah,
Okay.
a year of regular unprotected sexual intercourse becomes a reason why you would like to seek an assisted conception.
Okay.
Maybe one of them is IVF.
Yes.
All right. Then for people who have had children and you are trying to get pregnant again, regular unprotected sexual intercourse for 6 months is
Okay.
a need for you to begin to seek help.
All right, sir. So what misconception about IVF do you want people like to understand better? Like, is it safe? That's one of the things I want to like. So many people are afraid that maybe it's not safe. So this IVF thing sounds like one big deal to some people. So what these misconceptions? How do you think you want people to understand better?
Well, so far so good. IVF, like I said, is a process where we assist people to get pregnant. And so in the course of the treatment, you first of all do your investigations so that we can pinpoint where the problem is at. Then a fertility plan is drawn for you. And the plan is carried on. And at most times, women have to take injections and medications. So you, in the course of this treatment, you have to take injections. But the good thing is that the needles are very tiny. You take injections.
So it's not that painful. Don't be scared.
Yeah, they are really tiny injections. You take it for a period of 2 to 3 weeks. IVF is safe. IVF is a safe procedure. It starts by investigations. Couple come in, they do their tests so that we can know where the problems are. There are male factor infertility. It contributes about 33% of infertility, and also female factor.
So sorry, that male factor, it can still be resolved through IVF as well.
Yes.
Both parties, both male and female factor, they can. Wow.
Yes.
That is really, really nice.
Yes. So if it's motility issues, for instance, we can use the intracytoplasmic sperm injection. Thereafter, the embryo transfer is done. Then there are also female factor infertility, which also accounts to 33% of infertility. And we have both. So woman has infertility issues, and there is 1% that is unknown. So what are those male factor infertility? Low sperm count, for instance. The quantity of the sperms are not many. But with IVF, you don't need so many sperms, all right? You just need the biology of the sperms to be healthy. So in IVF, we just need maybe over 100,000 sperms. So men who have oligospermia, low sperm count, all right, IVF can be a way around it.
And that is to say that if you're so worried or bothered about you having a low sperm count, this is the solution. Like, you don't have to be so worried. Like, people get, this person has low, and tend to like stigmatize people with low sperm. we can all hear what our doctor is saying.
There's a
People
way
with
around
low sperm count, there's a way around it.
Yeah.
That is why it is very important to get informed. Okay.
So also you have low motility.
Okay.
Motility can be reduced also. The sperms are not swimming well. That is called astenosospermia.
Wow.
All right. So ICSI, intracytoplazmic sperm injection, can help to overcome that. So you also have azoospermia. That one, there is no sperm cells at all found in the semen analysis.
Wow.
So they have to see a urologist to further investigate why is there no sperm cell. Sometimes it can just be that the sperm is not being produced at all, or it can be that the channel through which the sperm comes out is obstructed. Okay, so for those who are not producing at all, they may need a donor sperm. Like I mentioned before, it is all about the agreement. If you and your wife have agreed to go for a donor sperm, it is okay.
So there are some people that don't, some men that don't produce sperm at all.
Yes, there are men who don't produce sperm.
Wow.
Yeah, but you know, ejaculation, of course, there's seminal fluid there, but there are no sperm cells inside. You know, there's a difference between sperm and seminal fluid. Seminal fluid is other secretion, carpal secretion, and so on and so forth. So many secretions come together with the sperm itself from the testis, from the epididymis. So that forms the semen. All right.
Yes.
Semen is a combination of seminal fluid and sperms. All right.
Yes.
So when you see seminal fluid come out, it doesn't always mean that there is sperm cells inside until you analyze and check for sperm cells. So these all account for the 33% of male infertility. Then women also have 33%. Maybe they are not ovulating.
Okay.
Or maybe the ovulation occurs, but the fallopian tubes are blocked due to infection, or the fallopian tubes are open and they have fibroids, adenomyosis, endometrial fluid, PCOS, and so on and so forth. So all these account for 33%. So you need to now also know that having done the investigation, you now need to know where exactly the problem is and find solution.
All right, everyone, that is a lot of information. I'm sure we all can hear new things that we've not even heard before. That is why information, I would always say, is very, very important. Like, I didn't even know that there are some men that do not produce sperm. Like, that is why information is key. You cannot always know everything. That is why you need to seek information, seek help. Don't just conclude on things you know nothing about. And that is why our doctor is here. So, Dr. Charles, looking back, what are you most grateful for about being an IVF doctor?
To me, I haven't been through a family with siblings that had infertility issues and came out of it with the help of assisted conception. I feel so happy.
That's where the passion came from.
Yes,
really.
I feel so happy. So when I see people going through infertility, to me, I feel I should reach out and help.
Yes.
So that gave me the interest to study embryology. And today, I feel so fulfilled, like a tool in God's hand. I feel privileged to be a tool in God's hand to help people come out of these infertility issues.
Yes.
So even if it's just this information you have heard, to me, it's a privilege to have been able to pass this information to you. You don't have to stay in the dark. These are things that couples need to discuss about. You don't have to say, no, it's my wife that has the problem, or no, it's my husband, he's been sleeping around, he's the one that has the problem. Or it's village people. And you stay there 1 year, 2 years, before you know it, 10 years. And by the time you are now coming, so many, a lot has happened to the body, and so on and so forth. And even you don't really want to have your children when you are old. Very
old age years.
How much time would you have to raise them? How much impact would you put in their life? I tell people that if Abraham and Sarah had the opportunity in our day, Isaac would have come young when they were much younger.
Much earlier.
There's always that information that we need.
Yes.
My people are perished for lack of knowledge. People are in the dark. Christians, are thinking that IVF is not natural. like I think we've been able to clear that
Clear that.
aspect.
Yes, that has been like
Yes.
really clear.
So don't stay in the dark. Don't stay in the waiting room for too long.
Too long.
You know, it doesn't glorify God when you're in the waiting room. It's when you
When there's
manifest,
solution right in
yes,
front of you.
that brings glory to God. So as
Yes.
couple, put yourself together, reach out to a doctor, reach out to a fertility specialist, ask questions, and start the process. And before you know it, you are out of that waiting room.
Wow, that is so wonderful. All right, sir. A lot has been said, and it's been an amazing time. Like I don't even know what to
Yeah.
say. Like I hope you guys have like taken lots of notes down, and you're well informed now about things you didn't know about surrogacy and IVF. So, what's your advice for people that want to consider, or people that are considering going for IVF and surrogacy? After all this has been said, like, what's your advice for them?
I think for me, it's very important you start on time. Start
Yes.
early.
Like I said earlier, start
Yes.
early, so you
IVF.
don't have your kids at old age.
Yeah, IVF is like a journey.
Okay.
Sometimes it can be a short journey. Sometimes it can be a long
Long
journey.
journey.
All you need to do is to build your stamina for the journey.
Yes.
Okay, so some people get pregnant at the first attempt of IVF. Some people maybe their second or
Okay.
their third, and so on and so forth. So you just have to keep at it.
Yes.
Start early and keep at it. So
Yes.
take the first step and be consistent with it till you get your own godly it.
Wow, that is so amazing. Thank you so much,
Thank you.
Dr. Charles. And everyone, we finally come to the end of the show. I hope you enjoyed every bit of the show, because I enjoyed every part of the show. I won't even lie. Like, I now understand so many things about IVF and surrogacy that I didn't even know before. And we're so blessed to have you. Like,
Thank
Dr.
you.
Charles, thank you so much for sharing this information with us. And guys, as we all know, at the end of the show, we usually present a special gift. This is the special gift, like a journal. We're presenting this to our amazing doctor in the house. Sir, thank you so much.
Thank you
For
I'm grateful.
this wonderful information. This is a gift from Ogomse Global to you. I want to say thank you for sharing this wonderful information with us. Thank you so much, sir.
Thank you. Thank you. I like it. It's a good one.
All right, thank you
Thank
so
you.
much, sir. God bless you. All right.
Amen.
All right, everyone. We finally come to the end of the show. Thank you all so much for watching this episode of Talk Show with Omotoyosi. And I hope we've all learned one or two things about surrogacy and IVF and everything we need to know about conception. Please, if you're new to my channel, you're welcome. If you're an already existing subscriber, please continue to watch and like our videos. If you have any questions, you can always comment below, guys. And don't forget to stay tuned and watch out for the next talk show. All right, guys, so that is all for today. And that is bye for now.